Hello and welcome. I'm Dr. Sandra Pereira, and today we're going to talk about a topic that generates a tremendous amount of curiosity, anxiety, and unfortunately, misinformation. The size of the penis, what's normal, and how to measure it correctly, both in terms of length and thickness. This topic, which was once almost a taboo, has become increasingly common in medical offices, online forums, and social media, especially with the rise in male genital cosmetic procedures. And before we go any further, I want to start by reassuring you with something that might surprise you. About 95% of men who worry about their penis size are actually within the medically normal range. Yes, you heard that right. In most cases, we're not dealing with a physical problem, but rather a distorted perception of the body. Many men feel inadequate due to unrealistic comparisons, especially with what's shown in adult films or on the internet, where bodies are often exaggerated or even digitally edited. And here's another interesting fact. This concern is far more common among men than among women. While over 50% of men report feeling anxious or dissatisfied with their size, only 5 to 10% of women say that penis size is a very important factor in a partner. So, take a deep breath. My goal with this video is to educate, inform, and above all, help you gain a clearer, more realistic perspective. Let's review real scientific data, learn how to measure the penis correctly, explore enlargement procedures and their risks, and even touch on a historical curiosity that might change how you view this topic. Let's start by understanding how the penis is actually measured. This is essential to know what counts as normal. There are two main dimensions to consider: length and thickness, also known as the circumference or girth of the shaft. How do you measure length? It can be measured either erect or in a flaccid, stretched state. Both methods are used in scientific studies, but the most reliable and consistent from a clinical standpoint is the stretched, flaccid length, as it correlates very well with erect length. Now, I'll explain how to do it correctly. 1. Use a ruler or measuring tape. 2. Place it from the pubic bone, exactly where the penis meets the body. You may need to gently press down on any fat to reach the bone. 3. Stretch the penis outward without forcing it, but firmly, and measure to the tip of the glans. If measuring erect, do the same, from the pubic bone to the tip, with the ruler aligned along the shaft. It's important to avoid measuring from the skin or along the underside of the penis, as that adds extra length and leads to inaccurate results. And how do you measure circumference or thickness? This is also crucial and varies greatly between individuals. 1. Use a flexible measuring tape or a string. 2. Wrap it around the midsection of the penis, not too close to the base or the tip. 3. Mark and record the measurement. You can do this either flaccid or erect, but most studies focus on the erect state. Many men overestimate or underestimate their size due to incorrect measurement methods or by comparing themselves to others in different states, which creates unrealistic expectations. Now that we know how to measure correctly, let's see what the scientific data says. A large-scale scientific review analyzed data from nearly 15,000 men worldwide. This type of analysis, called a meta-analysis, combines multiple studies to produce reliable averages. Average length. When measured erect or in stretched flaccid state, 90 to 95% of men fall within a range of 10 to 16 centimeters, that is, between 4 and 6.3 inches. The global average is approximately 13.2 centimeters, or just over 5 inches. This means that if you're within this range, you're part of the vast majority. At the extremes, medical terms are used. Micropenis is diagnosed when the stretched length is less than 7.5 centimeters, about 3 inches. On the other hand, an extremely rare macropenis is typically defined as greater than 24 centimeters, or more than 9 inches. Average circumference. Girth, or thickness, also varies, but follows a common pattern. In stretched flaccid state, between 8 and 10.5 centimeters, that is, 3 to 4 inches. Erect, between 10 and 13 centimeters, or 4 to 5 inches, with an average of 11.5 centimeters. So, when people talk about average size, these are the real numbers. The problem is that many people make comparisons to unrealistic standards, especially in the adult entertainment industry, where actors are selected for their unusual sizes and use camera angles or edits to exaggerate perceptions even further. The message here is clear. If you're within these ranges, you're in the absolute majority. And if you're outside them, that doesn't define your health, attractiveness, or masculinity. Now that we've covered what science considers a normal size, it's time to address a question many men ponder in silence. Is there a safe and effective way to increase penis size? First and foremost, I want to make something very clear. It's completely normal to be curious about this topic. We live in a society that constantly bombards men with unrealistic expectations about their bodies. But if you're thinking about altering something as delicate as your anatomy, it's essential to have the right information. Because, yes, there are procedures that promise results, but not all are safe, and most aren't even necessary. Let's start with methods for increasing thickness or circumference. One of the most common procedures today is hyaluronic acid injections. This substance occurs naturally in our bodies and is also used in facial aesthetic treatments. When injected into the penile shaft, it can temporarily increase thickness by 2 to 3 centimeters. The effects usually last 12 to 18 months, after which the body gradually reabsorbs it. This method is relatively safe when performed by a qualified professional using approved products. But here's an important warning. Not all injectable materials are safe. Some clinics offer non-absorbable fillers like PMMA, polymethyl methacrylate, or even industrial silicone, which can cause nodules, infections, chronic inflammation, deformities, and irreversible damage. For that reason, these substances are never recommended. As for penis lengthening, the options are more limited and riskier. There are two common procedures. One is pubic liposuction, which removes fat from the base of the penis, making it appear longer. But this doesn't change the actual length of the organ. It just improves visibility. 2. Cutting the suspensory ligament. This ligament anchors the penis to the pubic bone. Severing it allows the penis to drop forward, making it look longer at rest. But there's a serious downside. It doesn't increase erect length and can cause instability during sex. Plus, the risks of complications, scarring, and postoperative frustration are high. That's why both the World Health Organization and many international medical associations do not recommend these procedures as a first-line option. In many cases, the aesthetic benefits don't outweigh the physical and emotional risks. I also want to clarify something that causes confusion. Penile implants. Although they appear online as supposed solutions for size enhancement, in reality, they're designed to treat severe erectile dysfunction, not for cosmetic purposes. They're medical devices used only when other therapies have failed. So if you're considering doing something about it, the best tool you have is honest medical information. It's also worth reflecting on why you want to change. Is it for yourself or from external comparisons that may not even hold water? To wrap up this topic, I want to share a cultural story that might completely shift your perspective. In ancient Greece, the masculine ideal wasn't tied to a large penis size. Quite the opposite. Wise, strong, and admired men were depicted with small penises. Why? Because it symbolized self-control, rationality, and virtue. In contrast, large penises were seen as signs of excess, vulgarity, or lack of self-mastery. If you look at sculptures from that era, you'll notice that neither gods nor heroes had exaggerated sexual attributes. Over-the-top representations, like those of the god Priapus, were reserved for comedy or caricature. In other words, a large penis wasn't a symbol of power. it was sometimes a source of ridicule. What does this teach us? That standards of beauty and masculinity change with the times and cultures. What's promoted as desirable today might have been seen as the opposite in another historical moment. And if that's the case, why let something so variable define your self-esteem? The reality is that most anxieties about penis size aren't based on medical facts, but on social pressures, pornography, and misinformation. What's important isn't meeting some external ideal, but having a healthy relationship with your body and sexuality. Size doesn't determine your worth, your attractiveness, or your ability to give or receive pleasure. What truly matters is how you feel about yourself, how you care for your health, how you communicate with your partner, and the respect you have for yourself and others. If this information has helped you see things in a better light, subscribe to the channel for more real talk on men's health, because that's my goal, to bust myths with awareness, empathy, and honesty. Thank you for sticking with me this far.